So one of the most fascinating facts about cystitis is that the urinary bladder, an organ we have take for granted, has one of the most sophisticated protective barriers in our body, so known as a urothelial glycosaminoglycan layer, GAG layer, glycosaminoglycan layer. When this layer is disrupted, GAG, even slightly, it can trigger inflammation and pain, even without bacteria. We usually think of cystitis as a bacterial infection, most commonly caused by Escherichia coli, E. coli. And it's true actually, but there was an interesting. The mere presence of bacteria in urine isn't always enough to cause a problem, to cause symptoms, to cause pain and urination problem. The real story lies in the interaction between the bacteria and the bladder wall, this GAG layer. Pathogenic E. coli strains have thin hair-like projections called fimbria that allow them to cling tightly, my beloved, to urothelial surface. Once attached, they invade the cells from intracellular colonies and even hide inside the bladder lining, explaining why some patients experience recurrent infections despite antibiotic therapy. Another intriguing fact, as we said, cystitis isn't always infections. 99% of course it's infections, but we have an interstitial cystitis, painful bladder syndrome. It's a non-bacterial chronic inflammation characterized by urgency, frequency, and pelvic pain, but no pathogens. It's thought to be related to defects in this GAG layer, mast cell activation, and, of course, neurogenic inflammation, so actually psychosomatic problems. For an example perspective, always remember 3 points. Acute bacterial cystitis, typically caused by E. coli, diagnosed with positive nitrates, or nitrates, I don't know how to pronounce nitrates, and nitrates, I suppose, and leukocyte in esterase or urinolysis. Second, recurrent cystitis may require investigation for anatomical abnormalities or persistent bacterial reservoirs. And third point, interstitial cystitis diagnosed by exclusion, i.e. cystoscopy may reveal glomerulations or so-called Hannah's cells. So, my beloved, cystitis is not just a simple infection, it's a story of defense, invasion, and inflammation of the microscopic battlefield of the bladder wall. Okay, so acute bacterial cystitis, recurrent cystitis, and interstitial cystitis. Stay blessed.